Hello, it's Dr. Rhonda Johnson, and today is Tuesday, October 13th. And today I'm going to be talking again about the COVID-19 pandemic. We are experiencing another major surge in the number of infections, not just here in the United States, but in many countries around the world. But here in America, we're back up to averaging around 50,000 new cases a day, folks. This is happening. What the experts have been predicting in terms of a fall and winter surge. And the experts are saying that if nothing is done, we're going to see over 100,000 new cases a day. We're already seeing that in the northern Midwest and western states. They are getting hit very hard. In the state of Washington, for example, they are reporting that the rate of COVID cases is nearly 3 times higher for Black people and nearly 7 times higher for Latinx people and Native Hawaiian and Pacific Islanders. In Denver, the officials there are reporting the cases are now back as high as they were at the height of the pandemic in May. And the situation in Wisconsin is so bad that the hospitals are filling up so fast that they are having to open a field hospital this week to handle the number of sick people with coronavirus. And the American Academy of Pediatrics and the Children's Hospital Association have reported that more and more children are also being diagnosed with the coronavirus. In fact, between September 24th and October 8th, there have been more than 77,000 new COVID-19 infections that have been reported in children. So folks, we have to really do everything we can to try to prevent our risk of getting infection. Now, I want to also talk about the vaccine trials. You probably heard that another U.S. COVID-19 vaccine trial was paused. Pharmaceutical giant Johnson & Johnson just paused their phase 3 clinical trial of its experimental COVID vaccine on Monday. Now, I just want to reassure folks that this is not unusual, and that's why these vaccine trials take time. And that is why we are not going to have a COVID vaccine by the election day here in the U.S. of November 3rd. Now, I want to remind you that this pause may not be due to the vaccine itself, the experimental vaccine, because people in this trial are randomized. Half of them get a placebo and half of them get the experimental vaccine. So we don't know if the person who had the complication even received the vaccine. This complication could have been totally unrelated. Now, this is the second major vaccine trial that has been halted, the one by AstraZeneca, another giant pharmaceutical company, was paused last month because of a neurological complication in a volunteer. So both of these trials remain paused in the U.S. while health officials investigate whether these complications were due to the vaccine or whether or not they were unrelated. So I share this because, again, it's going to take time to get this vaccine, and I have complete reassurance that the pharmaceutical companies are not going to release this vaccine until they feel that they have a safe vaccine to immunize the American public with. So in the meantime, remember, the best infection from COVID-19 is one that never happens. So stay safe, stay the course, don't panic, and remember that even though we may be tired of COVID-19, the virus is not tired of us. This is Dr. Rhonda Johnson. My views are my own. Have a safe and blessed day.